So first I'll start wash my hands. So hi Ben.
Hi.
And second year physiotherapist.
Yeah.
Okay, cool. So my name is Sean. And first, since you have a proximal interphalangeal joint dislocation, so on your third finger, so normally this type of cases, they have a dorsal splint to prevent a patient from hyperextension. So after, like, for example, 2 weeks, the patient will have difficulty in straighten his finger because of prolonged immobilization. So what I would like to do now is to perform a passive mobilization on his third finger to increase his range of motion. So before the test and after the test, I'll do a pre-assessment. I'll do a goniometer testing. But since I don't have a goniometer here, so I'll just skip that testing and assume that I will do that testing. So before that, I need to ask consent. So can I perform the test on you and need to have a personal contact? So how do you feel today?
Yeah, fine.
Yeah. Okay, I'll start by asking him contraindications. So do you have any malignancy in any part of the area of treatment?
No.
Good. Then do you have any infectious arthritis?
Nope.
Do you have any metabolic bone disease? Okay, there's actually a list of contraindications, so just go through a few, and this is what you need to do before you perform treatment. So you need to consider patients' risk of contraindications of the treatment. So I'll start by pre-assessment. So assume that I don't have a goniometer here, I'll skip that, and followed by mobilization. So since he cannot extend his proximal interphalangeal joint, so what I like to do is to perform an AP, anterior posterior gliding. So what I like you to do is just to face your palm out for me. So how do you feel now? Good. Okay. So I'll perform the third finger. So I'll stabilize his proximal finger. Then I will perform on his distal finger. So I will first see for the R1 and R2. Since he doesn't have since it's non-irritable, I will perform grade 3 and grade 4. So first I will see for R1. So how do you feel here? You feel a stretch. Yep, good. So go to R2. So is this your hand of your movement?
Yeah, I think so.
Yep, good. Okay, so after feeling R1 and R2, I'll perform the grade 3. So grade 3 is just slightly after R1 and give him large oscillations for 90 seconds and 3 sets. Okay, so after performing 3 sets, I need to ask the feedback of the patient. So how do you feel now? So can I proceed? Yep. So I will try to proceed to grade 4. So to improve his range. Now go grade 4 is basically also after R1 and give a small oscillation towards the end of the range. Okay, so for 90 seconds and 3 sets. And I need to ask for the patient feedback again. So how do you feel?
Fine.
Fine. So after that, I'll perform a post assessment. So to see whether he has any improvement in range. And so thank you very much.